Ever wondered why some Europeans never sweat over a hospital bill, while millions in India still reach for their wallets every time they see a doctor? Let's break down India versus Europe in healthcare. The costs, access, and all the wild differences. Fast. Welcome back to Aspire Founder. Let's get right into it. First, the basics. Europe is like a patchwork quilt of universal healthcare systems. The UK's NHS, paid for by taxes. France, the Sécurité Sociale, also tax-funded. Germany, mandatory health insurance, everyone chips in. The big idea? Most treatment is covered for everyone. Now, India's a different story. There are government schemes. You might have heard of Ayushman Bharat, but about 70% of healthcare happens in private clinics and hospitals. That means most Indians pay out of pocket with no safety net. Here's your first surprise. In India, a whopping 62% of all health spending comes straight from people's wallets. In Europe, it's under 20%. Let's talk about what that looks like for your bank account. In Europe, seeing a doctor usually costs nothing, or maybe a few euros. Even major surgeries are covered. Now in India, a quick private consultation might set you back Rs 500 to Rs 1500, and a surgery can run into lakhs. Even with Ayushman Bharat, coverage is capped at Rs 5 lakh per family per year, and public hospitals are often overcrowded. Here's a mind bender. In Europe, healthcare is treated like a public right. In India, it's often seen as a consumer service. Ready for some eye-popping numbers? Life expectancy in Europe. In Spain and Italy, people live past 82 on average. In India, it's about 70. Infant mortality? Europe's average is just 3 deaths per 1,000 births. In India, it's almost 27. The reason? Europe pours money into primary care and prevention. In India, there's progress, but huge gaps between rural and urban healthcare still exist. Surprising fact. In rural India, there's one government doctor for every 10,000 people. Talk about a shortage. But wait, India isn't just playing catch-up. When it comes to healthcare innovation, India punches above its weight. Low-cost heart surgeries, telemedicine apps connecting villages to city doctors, and AI-driven diagnostic tools are just a few examples. Europe, though, is ahead with biotech breakthroughs and using AI for personalized medicine. Still, both face huge challenges. Europe's population is aging fast. Healthcare costs are climbing. India? The big issues are access, infrastructure, and training enough skilled workers. Here's a wild fact. Over 65% of India's population is under 35, but their healthcare systems still stretched thin. So what's the final takeaway? Europe's strength, universal access, and better overall outcomes. India's edge, affordable innovation, and entrepreneurial hustle. The winning formula for the future? Mixing Europe's focus on access with India's spirit of innovation. If you learned something new, hit that like button, subscribe to Aspire Founder, and drop a comment. Which system do you think will scale better in the future?